The cervix. The cervix is a thick-walled, a cylindrical shape with a relatively narrow lumen. Now the cervix, as you remember, we divided the uterus into 4 parts. The upper part, and its name is the fundus, then the corpus or the body, the isthmus, and the cervix. Now as you can see that the cervix is the inferior third of the uterus. It's about 2.5 centimeters long in an adult non-pregnant female. Now the cervix has 2 sides where there is narrowing in the lumen. One connected to the uterine cavity, and its name is the internal os, and the other side is connected to the vaginal cavity, and its name is the external os. Now for descriptive purposes, the cervix is divided into 2. One is the supravaginal part and the other part is the vaginal part. The supravaginal part is about 85% dense connective tissue. It contains mucus secreting simple columnar epithelium and smooth muscle fibers. Now the supravaginal part is covered from the posterior part by the broad ligament. Now the broad ligament is covering part of the uterus and the supravaginal part and covering part of the bladder, and the foldings of this broad ligament makes something like recesses. We have one in the anterior part between the uterus and the bladder, which is named the vesicouterine pouch, and posteriorly between the uterus and the rectum, and its name is the rectouterine pouch or the pouch of Douglas. And now with the vaginal part, it's a rounded part, protrudes into the vagina, and I'm talking about this part. Now the protrusion to the vagina makes about 4 recesses, and these recesses named fornices, 2 lateral, 1 anterior and 1 posterior. So it's a 4 fornices, and fornix for the singular one. The vaginal part is lined by stratified squamous epithelium, and this is the site for cervical carcinoma, and I'm gonna put 2 stars in that point. And it also has a mucus secreting glands. Now the cervix, it does not undergo remarkable changes, and it does not undergo desquamation during the menstrual cycle. But the changes happens in pregnancy. In pregnancy, the cervix undergoes proliferation in the mucus glands and will lead to secretion of more mucus. And finally, the blood supply. Because it's part of the uterus, it's supplied by the branches of the uterine artery, and it drains through the uterine vein into the internal iliac vein, just like the uterus.